And in interviews with parents, that same concern came across. Both recognising that they may not be there to look after them, but also recognising that often they didn't want to put the burden onto the person with autism's siblings, recognising that was quite a big responsibility. And I thought this quote was interesting because this person is saying of his father that it's hard to manage the health aspects, but actually the reason it's difficult is because of the autism. So those difficulties with physical health, mental health, are very much tied in with the issues that are intrinsic in autism. So that's just a snapshot of some of the findings that we had, that we found from the survey that we sent out. What I now want to look at are some of the actions that we've been taking within the National Autistic Society to try to help us to respond to the needs of people who are already in contact with us through our services. So we started in 2000, led by my colleague Richard Mills, who started to chart the ages and some of the support needs of people living in our services. At that time, primarily residential services, although we now have more people living in supported living services. And a group was established to look at their needs. From that, we developed a framework of good practice to help staff to be able to focus their services on that older group. And in 2008, we set up an action learning group to help us to draw together what we already knew about older people with autism, looking at training, services and resources. We run a very wide range of services within the National Autistic Society, including residential care homes, supported living and outreach, day services, drop-in and social groups, and befriending and mentoring. So we actually cater for, and a lot of outreach there, catering for the whole range within the autistic spectrum. And this was undertaken in 2008, looking at some of the age groups of people who were using our services then. It was a picture spot in time. But of course, what you can see there is a demographic that is going to move along. So we have to get a better understanding of how to work with older people with autism. These are people who are already using our services, and we want to be able to make sure we can adapt our practice to meet their needs as they grow older. So within the action learning set, we got together those service managers who have an older person with autism in their services to look at what were the issues that they were seeing in their services. What we were finding is actually most of our care staff are very young. They may have some real expertise in autism and in understanding autism, but actually they don't know very much about how it feels to grow older, and both the physical changes and the emotional changes and all those changes. Actually, many young care staff have really not come across that in their lives. There was also a real issue about our care staff having the confidence to challenge healthcare staff. So when they are having more contact with healthcare staff, perhaps with the older people that they are working with, they find it quite difficult to say, actually, we do see changes in this person's behaviour. We don't know what they're about, but we are the best people to describe those changes. And for many staff, that takes quite a lot of confidence. If you are working, perhaps talking to someone who has a lot of expertise in older people, geriatrics or whatever. Our staff were also very concerned about, we don't know what dementia looks like. We don't know what we're looking for. We're not sure if we're able to recognise these changes. There are changes in benefits and finances that they had concerns about, and some of the issues about compatibility with older people and younger people all in group homes. They had issues and concerns about they were seeing people's frustration as their physical health changed. Some increases in challenging and repetitive behaviour. We would guess, but we don't really know, due to people's lack of understanding about what's actually happening to them. And issues around increase in depression and mental health issues, and the ability for staff to recognise that. There were issues around mobility and housing, of course, that is made for mobile young people. Pat mentioned one of our concerns in the National Autistic Society is that we have a very strong parental lobby. We were started by parents, and they are very involved in our services. And most people, their best advocate continue to be parents throughout their lives. Now, when they are not there, it's really important for us as service providers to have someone outside of that service who can stand up for that individual and can speak on their behalf from an objective point of view. And should we be developing separate services for older people with autism? Do we know if they would want that? Have we asked them? And if people are going to be in generic older people services, how can we develop capacity? How can we train them? What we did was we developed a training package for which included some work on dementia and bereavement for support staff. We looked at some helping people think through the sort of flowcharts of, if you are seeing this behaviour, where can you refer? What can you do? What should you be thinking about? And we developed a range of books and resources for staff to help them to understand older age. But the real key thing that I think really comes through strongly is actually a good old age starts very early, and this is one of Richard's key thoughts. That actually, you have to be working. Staff need to be thinking about developing healthy old people with autism all the time, from the time they're in their teenage years, and looking at healthy lifestyles, good nutrition, good choices. Staff need to feel really confident in understanding that they do know that person that they're working with. They can describe their behaviour. They can see those changes. And that service needs to be very person-centred. Sorry, I'm aware of the time. So we know it's an increasingly pressing issue. We need more research about what old age looks like and how to support people. And we need to be able to support parents in doing that. We need to know how service should adapt. And I think the key thing that Michael said about sharing that information, sharing our learning, is so important. And we need to know about individuals who are outside of service provision. We need to educate social services commissioners so that if people do need support, they are able to access the systems at any point in time. And we need to act now. We need to put the investment into people when they are growing older, so that we are not working at crisis point. The investment goes in at the right time when people need that service, rather than very expensive services once it's gone wrong. Thank you very much.